I start with the students in semester 1, and we teach things like psychomotor skills, getting students ready to get involved in the manipulative procedures that they'll learn in semester 2 with me and Chiropractic Therapeutics 2. So in semester 1, we'll do some stuff like show you endurance exercises, learn how to balance appropriately so that we can be very good and hone in our skills in our manipulative procedures that you learn in semester 2. I think this is great, and that's what's unique with Keiser University's chiropractic program, is that in semester 2, we start our hands-on manipulative procedures. And a lot of chiropractic curriculum, it waits till about a year after their academic setting when we start to learn these procedures. So in semester 2, the students are learning thorax, rib cage, anteriorly and posteriorly. Other classes I teach are principles classes. We call them PCP, Principles of Chiropractic Practice. I teach this in semester 2, in which we talk about things early on about different chiropractic techniques that people in the US, Canada, and Europe commonly use. We explore things like independent contracts, independent contractor positions, associateships, and what it's like to be in solo practice. In Principles 4, we teach things like neuropathic inflammation pathways. It sounds intense, but we break it down so that students have a clear understanding on how the manipulative procedure can help benefit patients in pain and also the asymptomatic patient. The lesson that I think I'd like all students to learn is to be altruistic. Altruistic basically means that you're doing the patient a favor without having any sort of expectation in return. To be truly altruistic is to basically help patients out without feeling anything in return, whether it's money or the feeling of feeling good, basically. It's a hard thing to establish. I think, there's some people that are truly altruistic. We think of Mother Teresa. But I love that. And I also teach students to be empathetic. Not only empathetic towards patients, but also to their fellow colleagues that may be going through some tough times or maybe have some pain themselves. So thinking about memorable classroom moments is the times maybe in semester 1 when we get to meet and get introduced to all the students. They get introduced to the faculty as well. And I get to learn a lot of things about the students. For example, I learned that people like to hike on volcanoes. Some students came from Australia. Other students have 6 children. I think it's good that we are such a small class size. So I think we developed that really great family bond here with our students. Another memorable moment I can think of, besides being introduced to the students, is just today, for example, the semester 2 students and I went outside and we practiced different types of pathological gait down the streets in West Palm Beach, Florida. So we would practice a scissor gait, a waddling gait. So it looked like there was 20 pregnant women outside walking in a waddling fashion. So we bring fun to the learning because it is very tough. This is graduate program. It's considered to be a medical type of program because we're the Florida Chiropractic Board of Medicine. It's a lot of intense work, but we try to make it as fun as possible and help you to retain as much information as possible as well.